My name's Kurt Schroeder. I'm a registered nurse. I work at MD Anderson Hospital in Houston, Texas. My mother and my aunt guided me towards nursing school in the early 90s. I like working with people. I like knowing things. Scientific or mechanical. I can weld, rebuild an engine, carpenter work. Having a broad knowledge base helps me with patients because you can maybe explain things in layman's terms. They might not understand how a biology works in a human cell, but they understand how a watch works or how an engine works, which helps them understand their disease on a level they can relate to. It makes me feel good to help the patients understand their disease. Here at MD Anderson, I manage protocols for the physicians. If a physician is looking for treatment options for a patient, they might have you look at the patient for possible inclusion in that study. Every 2 weeks, normally we have an MPN group meeting. The physicians will attend it, the protocol managers, which is the research nurses. One by one, we go through the study's protocols that are open, that currently have patients on them. We want to be as unobtrusive as possible in patients' lives while still adhering as closely as possible to what the study requirements would be.
These studies are actually fairly difficult to understand, and he has read the protocols in depth and has understood them well and makes sure that things are done exactly as they're supposed to be done.
I'm basically your go-to person, main contact person for patients on a clinical trial. We're sort of like their concierge service. I'd give them my personal cell phone number, and they'll contact me on the weekend with questions and assist them. It's not an emergency, but to the patient, it's an emergency. It's important to empathize with your patients because what if it was your family member? You would want to get assistance as soon as you could.
He is, no doubt in my mind, a hero for our patients and our efforts in the MPN field.
I'm doing my job, and if I'm doing my job, I don't really need an award, but I feel good about it, so thank you.